Okay, so going through the derm test, number one was Dr. Paul sends home prednisone once a day for 5 days, then every other day for 5 days, then every third day for 5 days. And the owner, in my scenario, the owner's looking at the label, they're confused and wants to know why can't she just stop the medicine when Pogo stops itching. So my first question is, what do you tell her regarding the dosing? So for that answer, I wanted you to put, this medicine has to be weaned because the natural steroids in the body aren't being secreted while the animal is getting steroids. And so gradually we need to wean that for the full course. So you don't want to stop it just when they get better. You need to do the full course of treatment and then gradually and somehow explaining that to the owner, kind of putting it in layman's terms or to some degree. And then I have, what are two other instructions you need to tell her? So the main thing that I wanted to see in the answer was that prednisone makes, they will drink more and urinate more. So it does cause polyuria, polydipsia. So you have to warn owners that they may drink more, they may have to go outside. That's a huge clinical tip that I talked about in lecture. Also, that you need to follow the instructions. They can also have polyphagia. Sometimes they're more hungry when they're taking steroids. Sometimes they're a little jittery. Like in people on steroids, they sometimes say you can become like aggressive and angry. In an animal, they could act out and be a little more hyperactive. So those are all things. If I did take off, the whole question was worth 5 points. So if I took off some points, some people put, make sure you give with food. That's a good tip. Make sure you give it at a regular interval. That's another good tip. If it's once a day, that's easy. Twice a day, it really needs to be spaced out 12 hours apart. So, if you lost a point here, I had some people of the tests I've looked at that did not put anything about the urination and the drinking. And again, those are key client tips. And then it says, she wants to know if this medicine is curing the allergy. And you just needed to say that this is not curative. We are just treating the symptoms. So it's a symptomatic therapy. The underlying itching, eventually you need to figure out why are they pruritic. And eventually we'll get to that. And just bop in if you have a question, holler. On the next question, it was Miss Landero said my old dog was named Ozzy, but has Ozzy for chewing his paws, scratching his face. Dr. Ritz suspects a food allergy, and we're going to do a food trial for Ozzy. So A, list a common type of food used for food trials. You should either have put, you could put prescription ZD, you could put a limited, protein or carbohydrate diet, like, either it could be a hypoallergenic diet or a novel protein diet. As long as you put something that's the main food that they need to eat while they're on the trial. So you need to take them off their regular food and put them on one of these special diets. And again, you could use the hydrolyzed diets, you could use the novel ingredient diets. And then she wants to know if she can give Ozzy treats. No, really, Ozzy can't get treats because we do not know yet what Ozzy's allergic to. Unless, like ZD, I told you, ZD makes a ZD treat. So if it's a treat made from the allergy diet, or marshmallows. I told you guys, like one day in class, I kind of forgot to mention it in the main lecture, but marshmallows are pure sugar. And so they're typically not allergic to sugar. So if you feel like you have to give your dog something, you can buy the mini marshmallows, big marshmallows. So as long as you put something like that. And then I said, on average, how long is this trial going to take? It's usually at the minimum 8 weeks, but it can be like 8 to 12 weeks. What extends a food trial is typically if they have many reactions, like, because normally at the beginning, you just see if they improve. And that can take 4 to 6 weeks. I did tell you sometimes you'll see it really early. My dog was better in 2 weeks. And then you start weekly adding a protein or a carbohydrate back, like you add corn or you add wheat or you add pork or beef. And then if they have reactions, you kind of have to get them cleared up from that reaction before you start the next protein. So again, it can be a long time. And then I said, list 2 types of novel ingredients used in novel diets. So as long as, kangaroo, duck, sweet potato, lentils, green peas, even like someone told me ostrich, and I'm like, I have heard of that, So as long as you put, again, we're not talking a novel diet. The primary protein is never chicken or beef, and the primary carbohydrate is never really wheat, because those are or corn. Those are very common food allergens. So those are usually not part of a novel diet. The third essay question is, a dog is on schedule for a mitaban treatment. What does this patient have? More than likely, it has Demodex or demodicosis. The new kennel attendant has never done it. Are you supposed to rinse? No, the dip needs to stay on the patient. There's side effects to dips. What are 2 side effects to look for? So usually it can be vomiting, diarrhea, anorexia. Also some neurologic effects. There can be ataxia or like lethargy. So those are kind of the big side effects. I think someone had put pruritus, and I'm like, it could further irritate because it is a chemical. So there can potentially be some pruritus of it. So again, it is a chemical. Heavy-coated breeds such as gold, and this is starting the multiple choice, heavy-coated breeds as golden retrievers are predisposed to the acute moist dermatitis. So when they have the heavy coats, thick coats, and acute moist dermatitis is a hot spot. And it can come from being clipped. It can come from a contact allergy. But again, a hot spot, the fancy term is acute moist dermatitis. All of the following are aspects of treating atopy except. So there was allergen avoidance, symptomatic therapy, acupuncture, immunotherapy. Acupuncture was the wrong answer. Although you would probably meet someone that tried acupuncture on their dog. But the acceptable treatments are allergen avoidance, symptomatic therapy, which would be like antihistamines or steroids, and then immunotherapy would be allergy shots. And then signs of atopy usually develop between 1 and 3 years of age is the primary age. So it's typically seen while they're younger, not a puppy. When they're 6 months to a year and they're itching, they could have dry skin, they could have fleas, they could, the other thing I forgot to mention, and just as a side note, if an animal has been groomed recently, and sometimes they use very perfumey shampoos. I knew a groomer that actually put fabric softener in a bottle. Well, she did this to my dog. And she's a friend of mine. She's a great groomer. But her little trick was she used Downy fabric softener, diluted in a spray bottle, and she would spritz them, and it would help them be really smooth after the groom, and it would help her comb them out. Well, my dog, she groomed for me, and he was itching like crazy after the groom. And I was like, finally, I was like, this has to be something in the shampoo, because normally they feel better after a bath. And then she told me the products she used, and I was like, you put fabric softener? And maybe it was just too, and maybe other dogs don't react. My dog reacted. So I was like, please don't put fabric softener on him. So anyway, but it's kind of like if you use a new laundry detergent and you put your shirt on and then you're itchy. So sometimes contact dermatitis, which I maybe didn't go in depth, can happen after like a bath or something like that. The most common sign of atopy was pruritus. So that's the number one thing. There was alopecia. Now, alopecia can follow pruritus because pruritus is itching, but it's not like they develop alopecia and then they start, typically it's like chicken and egg. What comes first? Usually the pruritus. And hyperpigmentation can happen, but that's usually after they've been itching, and the area can become scarred and thickened. Which of the following is not a common form of atopy? It was environmental, food, fleas, all are forms of atopy. So the correct answer was all forms are atopy. And then let's see, the next one is when doing allergy testing in a dermatology office, they will most likely run which test? The answer was intradermal. So there is not, one of the answers was saliva. There's not a saliva test. One was serum, and I did tell you there is blood serum testing, but it's not specific. It's not the gold standard. So ideally, if you want to do allergy testing, you want to do the intradermal. It'll be more specific. Dermatophyte test media will change from what to what when it's positive. The answer was I had yellow, orange to pink, red. Everybody kind of calls it a different color. It is yellowy orange is normal test media. And then again, once it's positive, it gets this deep, it's like a deep, almost a pink red color. And so you'll notice the color change, and that indicates that that hair that you plucked and put in the media was positive for a dermatophyte. When screening for dermatophytes, a blank may be used during the exam. You're looking for fluorescence, and that was a Woods lamp. I put phyto lamp, doesn't exist. Heads lamp, headlamps are used on your head, but that's not. A Woods lamp is that UV kind of like fluorescent light, and then it shows up like bright red or bright white spots in the dark. So a lot of times in an exam, if they suspect that, they're going to probably go in with a Woods lamp first. And remember, only 50% of them fluoresce. So if it doesn't fluoresce, that doesn't rule it out. So, and that's always frustrating when you're recommending tests to owners and you say we may have to do another test. Okay, the other was match the causative agent with the description. So this was the matching. The common dog tick, Ixodes, is a form of dog tick. And I didn't give specific scientific names. I was kind of just talking about like genus is Ixodes. This mite proliferates due to immunosuppression. That's Demodex. So a Demodex usually takes hold when they're fighting another illness and they're immunosuppressed. Gram-positive bacteria often found on ear cytology, Staphylococcus. We talked about staph is a resident skin bacteria in everybody, people, animals. It normally does not cause a problem unless there's inflammation in the skin, and then sometimes it can proliferate and they can get like the skin infections, or in the ear, same way. This mite lives on the surface of the skin, that's Sarcoptes. Again, it doesn't live in the follicle. And this dermatophyte causes ringworm, that was Microsporum. Same as a hot spot. And again, this is acute moist dermatitis, not pustule and not acne and not mange. So would be acute moist dermatitis. This can be controlled with a hydrolyzed diet, and the answer is food allergy dermatitis. Now, I always tell you guys, I've not done a test myself on Moodle, but when I had paper tests for you guys, I always told you in anatomy, sometimes try to use your test for clues for other questions. Well, when I asked about what diet to feed Ozzy, and then here I have hydrolyzed diet, maybe that triggers you to go back to a question to help you. So, try to take your time and try to use the test sometimes to give you clues. Caused by an allergy to flea saliva, that was FAD. I wanted to write out flea allergy dermatitis, but I often refer to it in lecture as FAD. Caused by a bite. Includes a painful swollen chin in canine and feline patients, that's acne. So the denser acne, it tends to congregate on the ventral chin, and they don't even have to have folds if they have a smooth chin. But again, it can get very red. My cat did get a little sensitive when he had a really bad outbreak. Can be very painful and swollen. Inhalant allergy is also called atopy. So your answers were superficial pyoderma, acute moist dermatitis, or acne. Well, this is atopy, is another form of, to call it inhalant allergy. And again, bop in if you have any questions or you want further explanation. This is found commonly in breeds such as bulldogs, basset hounds, Shar-Peis. What do they all have in common? Skin folds. So skin fold pyoderma, especially bulldogs. A lot of times, yeah, owners will spend half their life just wiping out their little folds, especially around their face, sometimes near the base of their tail. You can do that. This is caused by Sarcoptes or Demodex. The answer was mange. So if you say, and I know we didn't get in depth about Sarcoptes, there was notes in your book about Sarcoptes. The difference is when sometimes says the dog has mange, it can either be from Demodectic or the Demodex mite or the Sarcoptes mite. So again, and the difference is Demodectic mange usually arises from an immunosuppression. Sarcoptes is usually picked up from another animal. So it can cause very similar looking lesions and symptoms, but the root of why they get Demodex versus Sarcoptes can be different. But sometimes people just say the dog has mange. That means it could either have Demodex or Sarcoptes. Coffee ground appearing discharge is seen with this, and this would be fleas. Now, I probably need to, I had some people put ear mites, and the ear mites I probably need to go back and like give people a point or look at what people put, because I've already graded, this was auto graded, and I kind of looked at a few because I did mention that the ear mite is also causing, is defecating, and there's debris. And sometimes when it mixes with the earwax and the debris and sometimes blood, it makes that. But I do say, like, if you look at the rump of a dog and they look like tiny little coffee granules or black dots, sometimes pepper. Yeah. So, and I don't, sometimes when I write a question, I'm like, I think I've told you guys this. I mean, I write a question, I'm like, it's 100% clear to me. And then I start grading it and I'm like, oh, they're all putting this or this. And I can see why, yeah, that maybe created some confusion. So I'm putting myself a note, derm test check question 20. So again, if I've already graded yours, yeah, Catherine, I saw, if I already graded yours, I may have to go back in. I have to figure out how to add a point back in, or I may just, I will figure it out. So I will probably try and fix that. Which of the following is not an ingredient found in novel carbohydrate diets? Your choices are sweet potato, wheat, green peas, and oat. Wheat is such a common ingredient in a majority of pet foods. So it's one of the high allergen, or, they react to it quite a bit. So a lot of those diets are going to replace it with oats, green peas, sweet potatoes, things like that. Definitely want to get rid of wheat. And which of the following is not an ingredient found in novel protein? Well, I had duck, bison, kangaroo, and pork. Well, if you look at all of those, what is the most common protein? Now, there's not a ton of pork, but there are pork, that's a more common ingredient that's more likely to be found in a diet than duck, bison, or kangaroo. So you should have put pork. The treatment for deep pyoderma starts with correcting the underlying problem. I actually got an email from someone about this. I got to get caught up with my email, but you want to start usually by actually treating the pyoderma. So for example, if a dog comes in with a deep pyoderma, the most emergent problem is actually the pus in the skin and the infection. And a lot of times if you can get the infection under control, then we can find out why did they get the deep pyoderma. I said sometimes this happens after grooming. I gave the example of my sister's dog that got it's called post-grooming furunculosis, but he was on long-term antibiotics. Now, in his case, we were like, it came from a grooming, but a lot of times you have to clear up the existing infection before. Oh, hi, you want to say hi? You come up here. You can say hi. You don't have pyoderma, do you? You just eat stuff in the yard. So we pooped out a big chunk of tennis ball this morning. So somebody ate part of his tennis ball. No. Okay. Look at your skin folds that you can get pyoderma in. Let's show them your chin. No acne. Okay, good boy. Okay, so what I was saying is, though, you have to kind of get the underlying infection treated, and then you can kind of get to the main problem. So he is pretty good, except, like I said, when he pooped this, I know I'm recording this, but whatever. When he pooped this morning, I was like, there's big chunks of something in there. I see a big chunk of plastic, which I'm like impressed that he actually pooped it out, because I'm like, that was pretty decent sized. And then I see this green and orange fabric, and I'm like, oh yeah, there was a green and orange tennis ball that I haven't seen lately. And then I see some other blue fabric. He's obsessed with tennis balls, like loves tennis balls. So, but he likes to chew the fabric off, and I thought I had taken them all away. Anyway, so, okay, so hopefully I cleared up question 23, 24. Deep pyoderma can sometimes occur after a grooming appointment. That is true, because I said the aggressive brushing, potentially, believe it or not, bacteria can be in these like shampoos and things. So sometimes can happen after that. Superficial and deep pyoderma rarely scar. That's false. Now, superficial pyoderma rarely scars, but deep pyoderma can, because it affects in the deeper layers of the skin, and it's definitely a more serious infection. A dog treated with veterinary flea products shouldn't have any signs of flea allergy dermatitis. The problem with this is, so that is false. What I kind of mentioned, there's so many different types of flea medications. There's oral, there's topical treatments, there's flea collars, but almost, I can't think of one of those that actually prevents the fleas from jumping on the animal. So if you have a flea allergy dog, and you're doing treatments, say you're doing Frontline or you're doing Sentinel or something, when that flea jumps on and bites, it may fall off and die. There are quick kill flea medications that you can, that's designed to prevent these infections. But the problem is, one bite from a flea, they've already injected the saliva, and that's what the dog is allergic to. So it's almost impossible. Now, that flea fell off and died, so you're preventing like a proliferation on the dog. You're preventing it from proliferating in your environment. So it's good, but the problem is it's very difficult to prevent them from jumping on and biting in the first place. And it just takes 1 or 2 bites, that saliva from the flea, to get into the skin to cause this allergy. So that's what I was going with that. The only cure for skin fold pyoderma is surgical removal of excess skin. That is true. You can cut the fold and take out some of that excess skin. Other than that, the only way you treat it is just to clean the areas and treat them symptomatically. Clean the fold, maybe put some cornstarch in there, maybe give them, you may need Pred if it's real itchy, but over-the-counter benzoyl peroxide can be used for feline acne. That's true. So we can literally, there are veterinary products for feline acne, but sometimes we'll just say, go get Stridex pads at Walgreens. So if we can recommend anytime for clients, I could recommend over-the-counter products, I did. They could go buy Benadryl at Walgreens. It's probably cheaper than buying, I'm not trying to undercut our clinic, but I'm also trying to help the client. And they appreciate that. That's actually going to help the client appreciate you and your hospital because you're kind of looking out for them. So that's something that can be done. Treatment for acute moist dermatitis includes a drying agent such as cornstarch to dry out the lesions. The problem is, and this sounds like that would be the good thing to do, but they have to, if they get dried out and they can get scabbed and cracky, we actually have to, the cornstarch can be used for like the skin fold dermatitis, but it's not a common treatment for acute moist dermatitis. You can put ointment, you can do Band-Aids, but you don't want to try to dry it out. Steroids are used sparingly in patients due to prolonged wound healing and suppressed immune function. That's true. So you can use steroids. They have their place, but we try to use limited courses of treatment. Doing a food trial, how long do we keep the patient on a rule-out diet on average? So I kind of already asked this in an essay, but 8 to 12 weeks. It was 4 to 6 weeks, which is a little short. 1 year, which is pretty long, and then 6 to 12 months, it shouldn't take that long. But 8 to 12 weeks is kind of a standard for a food trial. Which of the following is categorized as a dermatophyte? There's cystonophilus, ododectes. Now, I can't talk today. The first one, we're talking about the fleas. Ododectes is the ear mites. Staphylococcus is a skin bacteria, microsporum. Remember, anything that's a dermatophyte is a fungus, and when you see sporum, that tells you it's a fungus, and fungi spore. What categories of organisms are we looking for in an ear cytology? It was cocci, yeast, rods, all of the above. That's all the above. When you look at a cytology, now I want to make sure, and I was hoping on the test there wasn't confusion. If I say ear cytology is always 100x high magnification, and you're looking for, bacteria and yeast are microscopic. If you're looking at ear mites, you can do you're not doing an ear cytology, you're kind of looking at an ear swab or an ear smear. That's different. When, a mite, you're going to put a little ear stuff on a slide in a little bit of mineral oil, and you're looking for the mites kind of swimming around. When you look at cytology for yeast and bacteria, you can't have a chunky, thick slide. You're going to try to make a thin smear, heat fix, and look at it on 100x. So those are different types of ear. Now, you may have to do both in a patient, but it's going to you need 2 different slides. Typically, one for looking for mites, because it's in a little mineral oil, and you're going to look at that at like 4 and 10x. And then an ear cytology is going to be 100x, heat fixed, thin prep. So if you have questions about that, let me know. But those are different preps. What magnification we use to examine ear cytology? If you see cytology in the name, that's microscopic cellular level, that's 100x. That's oil immersion. Which of the following causative agents for atopes? You have weeds and pollen, trees and grasses, dust and molds, all the above, all of the above. All of those are common causative agents. And remember, the other thing I mentioned about allergies, if they're environmental, there's further subdivided into seasonal and non-seasonal. Trees, grasses, weeds, and pollen are seasonal. Dust and mold is non-seasonal, but both are forms of atopy, or all of those are forms of atopy, just one is seasonal and one is non-seasonal. And then, which of the following medications has an ingredient used to treat? Trazodone. So of these agents here, Trazodone will treat bacteria and it will treat yeast, but it also adds an ingredient to treat ear. Trazodone is probably the #1 medication we use for ear mites, and it stings like the dickens. So hold on tight when you put it in their ears, and I hope you don't have anything else to do to that cat, because they're gonna be mad. Just warn you. I'm not a fan of it. It works, but oh, they get mad. Term for giving allergy vaccines to contain allergens is immunotherapy. So you're taking what they're allergic to, giving it to them in low doses in a controlled fashion so that the immune system does not react when it encounters them next. That's a form of immunotherapy. Proteins that are broken down so small the body doesn't recognize them are called hydrolyzed. So if a diet is hydrolyzed, it has chicken and all those other ingredients. It's just broken down into its tiniest forms. List 3 treatment options for atopy. So it could have been, allergy avoidance, immunotherapy. You can use topical therapy. You can use systemic therapy. So systemic would be like antihistamines or steroids. Now, topical therapy, if you put something like shampoos or dips, that's okay. That's a form of topical therapy via a bath. A topical therapy can be a spray. A topical therapy can be a cream. Technically, ear meds are topical therapy whenever you're putting something on top of something. Which of the following is zoonotic? And you should have put Microsporum canis. Now, Staphylococcus intermediates, we can get bacteria, but the thing is, if I'm holding an animal that has a Staphylococcus infection, that's like a resident bacteria for them. That's a resident bacteria for us. So it's very rare that I would touch their skin and pick up their bacteria and it would infect me. But the thing is, if they do have Microsporum canis, which is ringworm, and we do get contact, we can get lesions. So the best answer there, the only reason Staph intermedius isn't, like I said, I don't want to touch, if they have a gross skin infection, but I already have skin bacteria on me. It's not going to necessarily make it worse for me. So the best answer here is Microsporum canis. And then 3 presenting signs for if the dog has atopy. And I said specifically lesions, but pruritus is itchiness, erythema is redness of the skin. They can get alopecia. They can get otitis externa, so their ears get infected. They can have pustules or papules on the skin. So those are all, as long as you gave me 3 presenting signs, even if you put diarrhea, now if they have atopy from food allergies, so I did accept that. I kind of was looking for more skin type signs, but it is true, if they have food allergies, sometimes they have chronic diarrhea. And that is, food allergies is a form of atopy. Okay, do you have any questions? Sorry, I know we're done, and I know everybody's kind of probably ready to get on to their break. So I will get the rest of these graded. Let me